back to welcome. We're back to the title of the webinar here, New Year, New Opportunity. So let's go ahead and get right into this. Oh, one more slide. Questions, ask away. I mentioned that to you just a moment ago. And do we have any questions? No. I want to share this article with you. This came across the wire. This is actually from 2015, but it still holds true today, even more so. So the title is Economic Pressures Bolster Case for Outsourcing Billing. And I just want to highlight some quotes from this article. So John Boland with Navigant Healthcare says, the greater the economic pressure on a practice, the more viable outsourcing becomes. It should ultimately reduce the cost of collections and maximize revenue, allowing a practice to invest in clinical resources and get better quality results. So what that's saying is doctors are realizing more and more they just want to practice medicine. They don't go to school for business, and it makes a lot more sense for someone else, a specialist like one of our licensees, to focus on the billing and some other things as far as getting the doctor paid fast, in a timely manner and properly. Nancy Enos, the certified coding instructor, says the pressure to upgrade technology and train staff to use it has further complicated the billing process. Many practices are looking to third-party billing companies to help them keep up to date with changes in EHR and practice management. Well, that's exactly what we're offering here. So it's like a perfect storm, really, when you think about all the different things that are happening in the industry right now. It's just the perfect time for someone like yourself to get involved in this business. And I'm going to, explain as we go here that you don't have to have any background in this whatsoever. We give you tons of support. We give you tons of training so that when you finish our training, honestly, when you go out and start talking with people about this business, you're going to find that you know more than a lot of the office managers out there and a lot of the doctors out there as far as revenue cycle management is concerned. So let's talk about the top 10 issues and concerns and challenges that doctors are going to have this year, okay? Number one, obviously it's getting paid. That's the big one. Number two, collecting copays and deductibles from patients. They're having a hard time doing that. All the different administrative burdens that they're going to have, rising operational costs, independence versus employment. A lot of people are seeing articles about doctors going to work for hospitals and closing their private practice. We're going to talk about that. Keeping pace with technology. We're going to talk about how expensive it is for a lot of doctors with the systems that they're using. HIPAA. That is a big one that we're going to be talking about, a service that we have that helps with HIPAA rules and violations and things like that. So we'll get into what that is here a little bit later. Implementing ICD-10, those are the medical codes. Every time a doctor treats a patient, there's a medical code that has to be sent to the insurance company. Well, those codes, they all changed October 1st of last year. So it's been a big challenge for them to try to manage those, and we'll talk about that. Number 9, document management. That's another issue that doctors are running into. And then finally, number 10, payers are dictating healthcare. They're actually telling doctors more and more what they can and cannot do, and doctors are fed up with it. So let's talk about those. So number 1, getting paid. So physicians find themselves under a constant pressure to get paid, which is crazy if you think about it. I mean, statistics, we're going to talk about statistics here in a minute. Market analysis estimates that 24 cents out of every dollar are wasted on administrative and billing expenses. So in other words, let me put it to you this way. Would you guys go work at a job and agree that you're going to get paid $10 an hour, but then the employer decides to just pay you $7 an hour instead after you start working for them? Is that, I mean, you wouldn't stand for it, right? That's what doctors are doing right now. So let's talk about, let's see, number 1, patient isn't eligible for services or hasn't shown proof of insurance. Okay, that's called incorrect demographics. That's called the staff is not able to properly check insurance and make sure that everything is okay before the patient comes into the office. We have a solution for that. Claims, number 2, claims are missing codes or the doctor is using invalid codes. We have a service for that. A particular service is simply not covered by insurance. Number 4, doctor staff did not get prior approval, and then errors and typos are made when completing the patient's information. So there's a lot of different things that have to be in place for doctors to make sure that they're doing it right and making sure that their claims that they send to the insurance company are squeaky clean. Because if there's anything wrong whatsoever, if there's like a typo in their name or their address or who knows what, the insurance companies, they don't want to pay unless they have to, so they're looking for any reason they can to deny a claim. So we're going to get into all the different ways that our system and our services eliminate a lot of that stuff, a lot of those issues. Here's another quote about the rejection rate. So doctors they're doing their billing in-house, or some of them are outsourcing right now. But even then, a lot of them are not using cloud-based systems like ours that are always up to date. And so if they're not always downloading updates or paying for updates or whatever, then they're going to have more rejected claims. Our system it eliminates the worry of having to think, oh, do I have the latest codes, or do I have the latest, the government said I have to do it this way now. We're doing all those updates for you. So the national average being 34%, when they switch to our iClaim system, believe it or not, we can get that down to less than 2%, the rejected claims, which is, it seems crazy, but it's true. And so the solution to those issues, that first problem, is our iClaim medical billing system. Now, this is the system that you guys will be using to do the billing, but also the doctor and their staff, they can use this system because it is a full-blown practice management system as well as a billing system. So in other words, all they have to do is log into it online, which it's a cloud-based system, so it's easy to use. They don't have to upgrade any equipment or anything like that. And what it does is it will actually verify the patient's insurance before they even come in for their first visit. So it verifies the insurance, makes sure everything is up to date, make sure the insurance is active. And what that does is that reduces rejections. Just that one feature that we have, it greatly reduces rejected claims, and doctors get paid very, very fast with this system. So the other thing with this system is, and this is a benefit, another benefit to being a licensee, is whenever you bring on new clients, guess what? ABS and our partners, we train and support and help implement the system for your new clients. I know, it's crazy, right? So we're doing all of this behind the scenes work for you, and it's just such a benefit to be a licensee of our company because we're doing all this stuff for you. So you're just focused on marketing your business, bringing on new clients, and everyone that you bring on, we start training, help them get on a training track, we get them to an implementation and a go-live date, and we're doing all this other stuff for you behind the scenes. So it's pretty cool. All right, let's talk about issue number 2, challenge number 2, collecting copays. It's always been a challenge for physicians. The staff has a hard time doing it. The software that they use a lot of times is very clunky, and it makes it difficult for them to record payments and collect payments. We basically eliminated the trouble with that with our system. Here's a quote from American Medical Association. They warn that physicians will get stuck with the bills from patients who take advantage of medical services but then fail to pay the premiums. So in other words, it's a big deal because doctors are finding out that if they don't have a system like ours that efficiently collects from the patients and allows them to pay online through a portal or whatever very easily, then they're basically doing work for free for a lot of patients. And that's what, that is one of the many challenges that's making them, either have to retire early or go work for a hospital or whatever. So we want to eliminate that. So the solution is we have a service called ChoicePay. Now, this actually allows patients to pay online. They can pay with a credit card, they can pay with their checking account, they can pay it all at once, they can pay it in monthly installments. So it allows the doctors to collect as little or as much as they can from the patient, as much as the patient is able to pay. And the thing is it makes it easy. It makes it easy for the doctor, it makes it easy for the patient, and it really does get the doctors paid more from the patients because of the ease of use of the service. Number 3, administrative burdens. So the administrative tasks are just piling up on doctors. A lot of people I talk to, they say, well, don't they have somebody in the office doing the billing and taking care of all this other stuff? Well, yeah. A lot of offices, what we have found, a lot of offices, they don't have a dedicated biller. They actually have someone who has to do the medical billing, and also, hey, can you check patients in? Can you answer the phone? Can you run the schedule? Can you do all this other stuff and do the billing? So what we're doing is we're taking just a few important pieces out of the office so that the doctors and their staff are freed up so that they don't have to spend, what does that say, a day or more per week on administrative tasks. I mean, if we can get the billing and some of these other things that we're talking about out of the office, that number is greatly reduced. The amount of time they're spending on administrative stuff is greatly reduced with our system. Let's see if we have any questions. What is EHR? Good question, Daniel. So EHR stands for Electronic Health Records. And so we have a product called EMRX, which is electronic medical records, but that's our version of EHR. And it is a service that can be sold. Well, let me back up. Let me explain what it is. It is, you know how doctors used to go into the exam room with a clipboard and they had your paper chart in there, and they would thumb through the papers, and they would look at your medical history. They would try to remember what the heck they did last time you were in there. They would try to remember what was wrong with you. Sometimes they can, sometimes they can't. Well, we've completely eliminated the paper in the exam room with EHR. And so it's been very, very cool for doctors because they can use an iPad, they can use a laptop or a PC or a Mac or whatever they want to do with our system. But it just allows them to more efficiently and effectively document the visits with the patient. And then, of course, at the end of the visit, they're using the EHR to select the medical codes that they want the billers to send to the insurance company. And that's you guys. You guys are the billers. So it instantly is, the codes are instantly transmitted to the billing system, and they send it to the insurance company, then the doctor gets paid. So that's what the EHR does. Hopefully that helps there. Rumi's asking, do you teach us ICD-10 codes? Rumi, you don't have to know much about coding at all. And I'm going to get into that. Excuse me, I'm going to get into that when we talk about the different services that help with the coding and the fact that our system is certified for ICD-10, ICD-9, and it actually teaches the doctors how to use the new codes as they're in the system. So, we do a live training that's a 5-day class in Dallas. Obviously, we can't certify you in coding in 5 days, and there's no need to. So when I get through some of these other services, when I get through explaining, hopefully it'll make more sense. And I would say probably less than 10% of all of our licensees go on to get some type of coding certification because it's just not necessary the way that we do it. Victor says, I have the impression there are several standards for diagnosis codes. Yeah, that's true. I was about to ask about updating the system, but you just addressed that, okay? If I have a doctor that requests customizations, how difficult is that to do? Good question, Victor. So a part of what we provide to you is we help you do any type of customization, and we can do those for you, or you can do them. It's very, very, very customizable. And probably the best thing would be, Victor, to get a demo of the system. We would be happy to do that for you. So just get back with your ABS business coach, and we can schedule a demo and kind of show you how all the customizations work. Victor's also saying, I'm thinking the software has logic built in that will notify us of payments that are over a certain number of days. Is that correct? Yes, that is exactly correct. All of the reporting is updated in real time as it happens. So the doctors are able to log in 24/7 and see exactly what claims have been paid, what's been rejected, which ones are in process. And that's actually a good question, because I'm glad you brought that up, because what we have with this system is full transparency, okay? That's something that doctors are not used to. So the fact that they can log in anytime they want to and see what you're doing and know that their money is safe and that they're getting paid faster, they love that. They love that they can check the reporting from the golf course. They can open up their smartphone, they can look at their schedule, they can actually communicate with patients, they can actually check prescription refills, all kinds of stuff from their mobile device. They love that. So yeah, so good question. Rhonda is asking, are there any financing options? Rhonda, we do have some financing options. Just get with your business coach and we can certainly send those your way. And Victor is asking, is there an organization that defines the required format of an EHR database? That's pretty technical. I'm going to say the answer is yes. There are certain standards, that EHRs have to follow. And in fact, the government really is the ones who are saying, well, your EHR has to do this, 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 and this to be certified for what's called meaningful use. So we can certainly get into that, Victor. If you get with your business coach, we can talk about that. But that's the beauty of being on our web-based system. We are constantly updating it. It's been certified for any government, any type of government rule and regulation or any standard that's come out. We're already certified for it and ready to go. There literally is no requirement that hasn't been met yet by our system. So good question there. All right, so where are we at here? What slide are we on? Number 3. How do I go down here? There we go. So number 3, administrative burdens. So we're still talking about administrative burdens. Michael Murphy, the doctor. I can't stand saying it. I can't believe physicians say this, but patient care has almost gotten in the way of documentation and charting. You don't want to hear doctors say that, but that's the point that we've gotten to. So that's what we're doing is we're trying to get rid of the paper so that you're not hiding behind like this lady is. She's hiding behind those giant stacks of paper. We're trying to move to a paperless system to make it easier, more efficient, and then help them with all those other things. So the solution to the administrative burden issue is really all of our different services put together. I mean, what we do, okay, so this is kind of a lot going on here on this slide, but what we do first before we talk about any of these services is we actually do a full practice analysis for a doctor to figure out what they really need, to figure out what their true problems are, what their real costs are. And that's important because a lot of doctors have no idea what it's really costing them to do their billing in-house and some other things that they're trying to manage. They really just don't know. And so what the practice analysis does is it helps them see the light. It helps them see that, oh, wow, based on the information I gave you, I'm actually spending X amount of dollars to do it in-house. I had no idea. So that's what we do first. And then once we do that analysis, you guys will give us the results of that analysis, and our support team will say, look, we think that you should probably offer these, 2 or 3 services that we have here, and we're also going to make recommendations on pricing, where you should price yourself so that you're going to be competitive in the market. So we're going to help you with all that. Number 4, rising operational costs. All right, so this is from Medical Economics Magazine. If you guys want to stay on, keep your finger on the pulse of what's going on, that's one website you should definitely check out. They say more than 84% of physicians surveyed said their practices are doing the same or worse financially than a year ago. So there it is right there. They take surveys all the time on, with physicians to see where everything is going, and 84% said they're the same or worse than a year ago. Not good. In a recent survey, nearly 70% of physicians said the transition to EHRs was not worth it, and they would not purchase their systems again because of poor functionality and higher cost. So let me talk about that for a minute. So a few years ago, we're kind of past this, but a few years ago, the government was telling doctors, hey, look, we need you to get on an EHR system. And if you do it by this certain date, we're going to give you extra money. So there were a lot of EHR companies that sprung up and cobbled together these systems that some of them worked, some of them didn't work very good at all, just so that the doctors could buy it and then get money, and then the doctors would get money from the government. So it was kind of a mess. And what we're seeing right now is pretty much all doctors out there have some type of EHR now, but a lot of them that were early adopters, they got some early system that wasn't able to keep up with all the changes, and now it's a piece of crud. So we're actually seeing a big shift where doctors are looking to switch to a much more efficient, cost-effective, cloud-based system like ours. Here's the solution. So our solution is called EMRX. That is our electronic medical record system. I mentioned some of these features, but it can be sold as a standalone or it's fully integrated with the iClaim billing system. So this could be a potential standalone revenue stream for you, but more than likely what's going to happen is they're going to want to use this with the iClaim billing system and the whole thing, which is better for you and better for them. It allows for what we call the 3 T's: talk, touch, and type. That's a big deal because a lot of systems, they force doctors to try to put information into the system and try to change their workflow that they're used to and all kinds of stuff. If they're using an iPad or a Mac, they can type on a keyboard into the system. They can, of course, touch on the tablet device with their finger. And they can also dictate directly into the iPad using the Siri functionality. So they don't even have to use a separate app. They don't have to use Dragon Dictation or anything like that. They can talk right into the iPad, and it dictates everything they want to say. And we've actually tested it for the top medical terms, and it's come back 96% accurate. So Siri has actually gotten a lot smarter over the years. So that's been really cool. And when we demo that for the doctors, we actually do the demos for you. When we show them how that works, they're very, very impressed because they're not used to seeing technology like that. And then, of course, when the doctor gets done using this with the patient in the exam room, it immediately transmits the claim information over to the billing platform, iClaim, and you guys have access to send it to the insurance company right away. So you're able to send those claims. I mean, theoretically, you could send that claim to the insurance company before the patient even has their clothes back on. I mean, that's how fast the system is. I mean, when you're able to do that, that means doctors are getting paid in like 7 days. They're just blown away when they start using our system. They're like, wait a second, I'm already getting checks from the insurance company? Like, what's going on here? So very cool, cloud-based, easy to use. And again, this is something else. You'll find this pretty much with all the services that we have. Our team trains and supports your clients on usage of this system, so they can reach out to us for support, on the software questions and everything. And so, if they know that you are the owner of this business and they have your cell phone and they can call you if there's any, big issues, but they can also contact the software company directly, they feel very safe and secure in knowing that they're in good hands, and that's what you want. Number 5, independence versus employment. So physicians are starting to get fed up because there's so many rules and regulations. There's so many things that they're having to deal with. They feel like they're stuck with just a few choices, which is retire early, go work for a hospital, and be an employee, which they don't like, or hopefully we can get to them and before they make those decisions, and we can help them turn their practice around and stay private. So here's a quote from Dr. Dave here. It says, some physicians are returning to private practice because their compensation from hospitals became less attractive after their contract expired. So they're finding more and more that the physicians, they don't like going to work for hospitals because they feel, they have to obey, they have to work by the hospital's rules. They make a certain wage no matter what happens. Their wages are capped. And they're treated like an employee, which they are, and they just don't like it that way. So we're actually seeing a trend of going the other way where a lot of doctors are going back to private practice. Another quote here from Dr. Dave says, I'm sorry, he's not a doctor, he's the CEO of OmniMD, sorry. During the initial honeymoon period, he says their pay was based on the previous 3 years of tax returns. That's great. However, the contracts were up and the hospitals switched to performance-based pay, which ended up being lower. So they're telling the doctors, hey, you have to jump through these hoops here and dot these I's and cross these T's. And if you don't do that, then you're not going to get paid as much. They hate that. And I have recently run across several articles that you guys can look up on these sites here, Fierce Healthcare and Physicians Practice, that talk about small practice, private practice is still seen in a very, very positive light, okay? So if you guys want links to these articles, you can, get back with your business coach, or we actually, excuse me, we actually tweeted these on our ABS Twitter. If you want to go out there and check it out, they're out there for you to read, and then you'll see that it's not as bleak as it may seem, according to some people. Number 6, keeping pace with technology. So the Medical Group Management Association, they did a survey, and they found out that the median cost of business operations, including software and IT staff, is now about $52,000 per doctor. Okay, so some of you guys may not realize how much money doctors are sinking into software, hardware. See, if you have a non-cloud-based system, you have to get servers, you have to get computers, a certain kind, a certain Microsoft computers, and most of the time, you've got to have IT staff, whether they're remote or full-time, in the office or what, and that costs a lot of money to pay for all that. They can get rid of all that cost. I mean, they can cut that cost down so much lower with cloud-based system. It's not even funny. So that's what we help them show when we do that practice analysis. Here's the solution. We have no servers. This is completely cloud-based. If your clients, if they have internet access, they're good to go. They don't have to get new computers, new laptops. They don't have to get servers, nothing. So it doesn't matter. And the same goes for you as a licensee. You don't have to upgrade anything at all. I mean, if you want to use this business as an excuse to get a new computer, you can. But it doesn't matter how fast the computer is. It doesn't matter the hard drive space. The only thing that matters is if you have a good internet connection. And where can you go these days where you don't have a good internet connection? I mean, it's not, you can't hardly find a place with no internet these days. Speaking of internet, you could have multiple backups as far as like, I've got a hotspot on my cell phone where if my internet goes down, I can literally connect my computer to my cell phone and I'm on the internet still. Or I could just go down to Starbucks and take my laptop and I log into our online system over there, because you can go anywhere in the world with an internet connection. So it's just really, really cool. You don't have to have IT staff. The backups for the system are done automatically off-site, so you guys don't have any patient data residing on your hard drives, which is a big deal. You don't want to get in trouble. And then free updates and free support and training. I mean, you can't beat it. All right, let's look at any questions here. Eric says, does the practice analysis require us to be on-site, or can it be done remotely? Yeah, Eric, it actually can be done remotely. It's a series of about 30 questions, I think, is what we're up to now. So it takes maybe about 15, 20 minutes. I would say that the majority of licensees probably try to do that face-to-face with the office manager. But yeah, some licensees do it remotely if they have to, especially if they're out of state or something. No problem. Victor is saying, are they looking for cloud-based or outsourced billing? Not quite sure what that means, if you want to clarify that, Victor. Deval says, hi, Jason. My name's Adam, but that's cool. Please share the recording session of my email. Okay, so yes, we'll definitely send you the recording. If you guys get back with your business coach, we can send you the recording of this webinar. And Victor's saying, if the system is cloud-based, it must reside on a server. The server is a web server. Yes, that is true, Victor. The key thing to note with that, I mean, everything is on a server. The whole internet is on servers. The key thing to note is that every single time, we're going to treat the security of those servers better than you can. And I say that with all sincerity, because literally we have redundant servers on 2 different power grids on 2 different sides of the United States. So even if one power grid goes down, if one server goes down, we're literally still up and running, no problem. These servers are housed in bomb-proof buildings with biometric access. So we take security very seriously, and there's no one getting in there that's going to steal anything. It's just not going to happen. So we have the funds, we have the resources to protect these servers as much as you possibly can. I mean, we have the same security measures that banks do. So it's as secure as it could possibly be. I mean, nothing is 100% guaranteed for life. I mean, things do happen, but we have so many different things in place. it makes it a good move. It makes it a good move. So here's what I wanted to talk to you guys about. HIPAA, Health Insurance Portability and Accountability Act. Basically what this is it's the government saying, hey, you need to respect patient information. You need to treat, this actually goes into what we were just talking about. You need to make sure that you are treating the patient data with respect and protecting it to the best of your abilities. So what is happening this year, and it's actually been happening for the past couple of years, they've really started to crack down. The government has started to crack down on HIPAA violations. So these violations are, I mean, they can be anything. They can be a stolen laptop. They can be somebody took some patient records and dumped them in a trash, a public trash can somewhere. You name it. The violations can start anywhere from $100, can go as high as $50,000 per incident, capping at $1.5 million annually. I mean, this is a big deal, okay? So what we have found is it's been very difficult for practices to maintain their HIPAA compliancy and do everything they're supposed to do, just because HIPAA will send them a couple of dusty old manuals that they have that is just these paper forms that you read and fill out, and then you put it on a shelf and you forget all about it. And so it makes it very difficult to stay up to date with all the new rules and regulations, and also you've got new staff, turnover. You got to make sure that you train everybody to do everything right. Same goes for if they don't have a cloud-based system. There's all this stuff that you have to put in place to make sure that you're guarding your servers and your laptops and your computers and all this other stuff. So it's become kind of a nightmare for doctors. Let's see if I can go to the next slide here. There we go. This is actually pretty interesting. If you guys go Google this or go type this in, the healthandhumanservices.gov, they have a wall of shame that actually lists the names of the offending doctors or practices, how many individuals were affected, the date and location of the security breach. So there is this is something that doctors do not want on their records. They don't want the public to be able to go and say, whoa, this guy doesn't know what the heck he's doing. So that's another reason why this service that we have has been very, very helpful. So here's what our service is called. It's called Compliancy Guard, all right? So what we do is we have a system that is completely web-based. Of course, it's cloud-based. That's all we deal with. And it allows for the doctors and their staff to go online and get trained in HIPAA regulations and stay up to date and stay certified and receive a seal of compliance from us that they can promote to let everybody know that they are absolutely HIPAA compliant and they're doing everything that they can to maintain the patient data and information. So when patients see that, they are so put at ease in knowing that the doctors are greatly, taking great steps to maintain the patient data and make sure that it doesn't get corrupted or stolen or anything like that. It's a very big deal. And this is another service where we support and train your clients on the usage of the system. But the cool thing is it's web-based. It's not sitting on a shelf somewhere. So any new staff member that gets hired or whatever, it's very easy for them to just go log in online, take the HIPAA test, and boom, they're certified. And that is another service out of all these services I've been talking about. This is another one that's a revenue stream for you. You can make an annual dollar amount by charging an annual fee to doctors to re-up this compliancy every year. That's how we do it. Number 8, implementing ICD-10 codes. The new ICD-10 codes, the new version of codes, those came out already. But if you guys, I don't know if you're aware or not, but it went from like 16,000 codes to like 70,000 codes. It was a huge amount, a huge change. And doctors are going to be struggling with those new codes for a long, long time. Well, I mentioned briefly earlier, our system that we have, our iClaim system, it actually, well, the EMRX system, I should say, it actually walks doctors through the new codes and the old codes. So in other words, if doctors are still not sure what codes they want to use, all they have to do is look up the old code, and they don't even have to look it up. Like, it's actually part of the the process as they're treating the patient using the iPad or whatever. When they get to the end, it will say, okay, now select the ICD-10 code that you've used for years. They select that code, and then it will say, okay, well, that code turned into these 3 codes, so which one do you want to use? And then they just select the code they want to use, and that's the one that gets sent over to the iClaim billing company to get billed. It's as easy as that. So it's educating them as they go, and it's very cool because we keep that completely updated. Anytime there's new codes added or changed, we're doing all that for you behind the scenes. So that was part of the reason why you don't really have to know coding at all, because the doctors are making that determination themselves, and your role as a licensee really is more just data entry, processing the claim, and the most important part is following up on the claims that were sent to make sure that they're paid in a timely manner. That's what licensees do. So the solution specifically for the ICD-10 thing, you actually may have doctors that say, you know what, I've got a lot of codes I've got to manage here, and I need some help. Can you help me make sure that I'm coding these claims properly? If they do ask you that, the answer is absolutely. We have a service called CodeRight. How it works is it's a bank of 200 plus certified professional coders that we have on staff that will take a look at the doctor's claim and code it properly before you send it to the insurance company. So it's cool because licensees, they go through our 5-day training class and they're able to promote their business as a certified coding company without themselves having to go through 2 years of coding school. So if a doctor ever asks you, are you certified in coding, can you help me with that? The answer is absolutely yes. So what CodeRight does, it helps with overcoding and undercoding. Overcoding is the doctor puts too many codes and they could get in trouble with Medicare, because they're getting paid for something they didn't do. Or undercoding is they're not coding enough and they actually should be getting paid more. So CodeRight helps them get paid more if they're undercoding. So it's just a really good service, and obviously it's protecting the doctors from any kind of mistakes or getting fined, by Medicare by coding improperly. So really cool service. Let's take a look if we have any questions here. Anel is asking, do we have access to the iClaim software after the training class? Yes, absolutely. We'll give you a demo of the system right now before you become a licensee. We give you hands-on with the system in the class, and we give you a login to play around after you get back home. So yeah, there's tons of ways to get to continue your education on the iClaim system. So good question there. All right, number 9, document management. The government is forcing doctors to go paperless. They want to reduce paper, and understandably, I mean, there's a lot of cost in printing and even the cost in having staff have to go try to find a file and research it, and all of that stuff adds up. It's a heck of a lot easier when it's just right in their in their computer where they just search for it right away. So we have a solution for all the paper documents that doctors have. And this service really is more for their historical files that they don't access on a regular basis. The other ones that they use on a daily basis are more, they go straight into the EMRX system. You can scan them in there and it's really cool. But this is like if they have filing cabinets of old patients that they haven't seen in years and stuff like that. This allows them to scan all of those files, get rid of the filing cabinets that they have, and guess what it does? It frees up that space to where if they've got a room full of filing cabinets, they get rid of those. Guess what? Now they can turn that into another exam room, and they can see more patients and make more money. The system is totally cloud-based. Again, it's always cloud-based, easy to use. You can index all the documents. You can search for anything you want to search for. And as always, it's another revenue stream for you. Pretty cool. Last one, number 10, payers dictating healthcare. So the rules are constantly changing. The regulations are constantly changing. Medicare, Medicaid, they're always coming out with some new payment model. Well, now you got to do it like this. Now you got to do it like this. And then to top it off, they're sending these recovery audit contractors, RAC auditors, to find mistakes and pay these contractors for mistakes that they find. So it's really, really unfair what they're doing to doctors, because it's a double whammy. They're making all these changes that they have to try to keep track of, and then if they don't do the changes right, they're being fined, and these guys are getting money for that. So they're going to, of course, try to find anything they can to get paid on it. Here's a quote from Tatiana. She's an attorney that specializes in healthcare IT. The federal government can audit Medicare patients' charts, while individual states can audit records for Medicaid patients, since they fund Medicaid up to 10 years after a patient's treatment. Well, we have a solution for that as well. It's called Audit Guard. Okay, so what this service does is it's a certified coding team that reviews 50 patient charts. So your job is really only to gather the patient charts and provide them to our Audit Guard team. And what we do is we do a full reporting system, and we take a look at everything that the doctors are doing and the staff with regard to the patients. Everything from check-in, checking the insurance, treating the patient, doing the claims, coding the claims, everything. And what we do is we make recommendations on, hey, well, you should do it this way, you should do this way, this way, this way, and we basically get them on track to where they're doing, they're basically dotting every I and crossing every T, and they're, following all of the rules and regulations as they're laid forth by the government, which is what's very, very difficult. But that's what this Audit Guard program does. It shows them exactly what to do, and walks them through and handholds them and says, once you've done this, then the chances of you being fined by Medicare are greatly reduced. I'm not going to say it doesn't completely eliminate any chance of an audit, but if they do get audited and they see our Audit Guard certification and reporting, the chances of them being fined are virtually eliminated. So this is a very big deal, especially for the practices where the whole thing is just a mess and everybody's tearing their hair out and they have no idea what's going on. And that's more common than you might think. So we do the work, you make the money, additional revenue stream. Boom. So we're almost to the end here. We are the only company I know of that has a money-back guarantee that will let you actually sit through our entire live training class and get your money back if you don't like it. It's simple. Come check out the training. If you don't like it, we'll give you your money back. I mean, it's as simple as that. That's in writing in our agreement. Okay? So you can use that as your final safety net, if you will. You got to fill out our agreement. You got to pay the license fee in full, and then come to Dallas, go through the training. You don't like it, get your money back.